So today we'll be dealing with urinary tract anti-infective agent. So let's give a general introduction of UTI. So urinary tract infection is an infection in any part of the urinary system. In any part of the urinary system like kidney, ureter, bladder or urethra. It is defined as presence of at least 1 lakh bacteria per ml of urine. So if there are around 1 lakh bacteria which are present in urine, then the particular patient is said to suffer from your urinary tract infection, and the normal bacterial count in the urine is around 1000 per ml of urine. So if the bacterial colony increases, count increases in the urine, then the patient is said to suffer from urinary tract infection. Okay, most infection involves lower urinary tract, the bladder and the urethra. So this is where the infection usually occurs, and it is common disorders in all ages in both male and females. Okay, in both male and female. So etiology. So most of the causative organisms for UTI infections are E. coli, Pseudomonas aeruginosa, Streptococcus faecalis, Streptococcus epidermidis, and Proteus mirabilis. So these are some of the causative organisms for your UTI infection. So what are the main causes? Basic, not means you don't urinate frequently. So if you try to retain the urine, even that causes UTI infection. Sexually transmitted diseases like gonorrhea causes inflammation and infection. Presence of tumors, stones and foreign bodies in your urinary tract. This also can lead to your UTI infection. So these are some of the causes of your urinary tract infections. So what are the signs and symptoms? What are the signs and symptoms of your urinary tract infections? That is abrupt onset of micturition, pain in urethra during voiding, suprapubic pain and tenderness, blood in the urine, that is hematuria, dysuria, fevers, feeling tired, apathy, shaky, and pressure in your lower belly. So these are some of the signs and symptoms of your urinary tract infection. Okay. Now, where does this affect? So the part of the, and what are the signs of symptoms? So if it is affects the kidney, then it is called acute pyelonephritis. Okay, upper back and side flank pain, high fever, shaking and chills, vomiting and nausea. These are the signs of bladder, cystitis, pelvic pressure, lower abdominal discomfort, frequent painful urination and blood in the urine. These are some of the signs and symptoms of urinary tract infection. Urethritis, that is burning during urination and discharge. So this is all are the signs and symptoms of your urinary tract infection. So to treat this, there are some synthetic antibacterial agents which are used for the treatment of urinary tract infection. Many drugs used to control urinary tract infection because of their ability to develop concentration in the urinary bladder adequate to inhibit the growth of infection. So the drugs which have got high concentration in your UTI, they are used for the treatment of urinary tract infection. So these drugs have got presence high concentration in your urinary tract. Some of the examples are fluoroquinolones are broad spectrum antibiotics effective against both gram-negative and gram-positive bacteria. They play an important role in treatment of serious bacterial infection, especially hospital-acquired infection and others in which resistance to older antibacterial classes are suspected. So if there is a bacterial resistance to older classes of antibiotics, then this particular agent, that fluoroquinolones, can be used for the treatment. Fluoroquinolones are also used for genitourinary infection and also widely used in treatment of hospital-acquired infection associated with urinary catheters. So basically, when you are admitted, the catheters are provided. So this, whenever you try to remove it, this will lead to an infection. So in that case also fluoroquinolones can be used. Okay. So as I said that they are broad spectrum antibiotic like Citrobacter, Proteus, Klebsiella, as well as Salmonella species. Most except fluoroquinolones are not active against Pseudomonas aeruginosa, and only fluoroquinolones are active against Pseudomonas aeruginosa and influenza. Inactive against anaerobic and gram-positive bacteria. They have good bioavailability. Pharmacokinetics is they are good orally bioavailable and reach urine enough concentration to be effective in the UTI. So they got an increased bioavailability in your urine. Okay, so that's why they are more effective. Now let's go for the classification. Of your urinary anti-infective agent. Urinary anti-infective agents. Okay, sulfonamides, quinolones, nitrofurantines, methylamine and its salt, and some of the antibiotics like penicillin antibiotics, cephalosporins, tetracyclines. They also can be used for the treatment of urinary tract, cotrimazole. These all can be used for the treatment of urinary tract infection. Basically, in this I think we'll be dealing more with your quinolones, nitrofurantines, and methylamine and its derivatives. So quinolones can be further classified into first generation, second generation, third generation, and fourth generation. So they can be further classified into first, second, third, and fourth. So first generation quinolones are NALIDIXIC acid, cyanoxaline, rosoxaline. These are the first generation antibiotics. Second generations are NORFLOXACIN, ciprofloxacin, ofloxacin, SPARFLOXACIN, and enoxacidine. Okay. Third generation are valofloxacin, levofloxacin, and timofloxacin. And the fourth generation quinolones are linafloxacin, gatifloxacin, gemifloxacin, and moxifloxacin. So these are some of the examples of your quinolones as per their generation. Generation means as they were discovered. First generation, second generation, third generation. Next examples are nitrofurans like nitrofurantine and nitrofurazone. Methylamine derivatives are methenamine. So these are some of the classification of your UTI agents. Now let's come to the mechanism of action. How does this mechanism fluoroquinolones act? So the fluoroquinolones enters the bacterium by passive diffusion through pores or porins which are present in your cell membrane. Okay, and once they enter, they inhibit the replication of bacterial DNA by interfering with the action of DNA gyrase enzyme. So they inhibit the action of DNA gyrase enzyme, that is topoisomerase 2 and topoisomerase 4 during the bacterial growth and cell division. So they will inhibit the sealing and of your bacterial helix. So once the sealing of your, so when the DNA replicates, so it undergoes uncoiling and it requires resealing of your DNA. So this is done by your topoisomerase 4 enzyme. Okay, so this is blocked when your fluoroquinolones combines with your DNA topoisomerase complex which is formed within the cell. So this will inhibit the cell division and thus inhibit the growth of your microRNA, thus leading to the cleavage of your DNA. This is how your fluoroquinolones act. Okay, this is how the fluoroquinolones act. Moreover, they bind with the topoisomerase 4 enzyme which is required for cell division, So this is the mechanism of action of your fluoroquine. Very important you have to know. So they block what? DNA gyrase, which is topoisomerase 2, as well as topoisomerase 4 enzyme, which is necessary for bacterial growth as well as cell division or reproduction. So these are the mechanism of action of your fluoroquine. So in short, fluoroquines act by preventing the bacterial replication and transcription. This is how they can act. So they will either prevent the bacterial DNA replication or transcription, that is formation of your new cells. So quinolines inhibit, as I mentioned, bacterial DNA gyrase or topoisomerase 4 enzyme, thereby inhibiting your DNA replication and transcription. For many gram-negative bacteria, DNA gyrase is the target. In case of gram-negative bacteria, DNA gyrase is the target, whereas in topoisomerase 4 is the target for gram-positive bacteria. So topoisomerase 4 is a target for what? Gram positive bacteria. So the most important feature is that it should contain a fluorine at the C6 position, and there should be some group present at the C7 position also. So that is necessary for the activity. Now let's go for the SAR of your fluoroquinoline. So what does it contains? If you see, it contains an pyridone ring. It contains a pyridone ring which is attached to a benzene ring with a carboxylic acid at the third position and a carbonyl at the fourth position, fluorine at the sixth position, and a heterocyclic group, saturated heterocyclic group at the seventh position. So which will determine the active. So your beta carbonyl compound, carboxylic group, is necessary for your DNA kinase, whereas fluorine is necessary for your activity. Okay, these are the two very important which is necessary for your binding of fluoroquinolines to your DNA kinase. Okay, let's go into the role of each. So there is, if you see the structure, it is an pyrido, 4-pyrido. It is a 4-pyrido fused to a benzene ring. So it contains nitrogen which is substituted with an alkyl, basically cyclopropyl, ethyl or methyl. There is a double bond between the second and the third position which is necessary for the activity. There is a carboxylic group at the third position. There is a carbonyl group, that is C double bond group, at the fourth position. Fifth position can be substituted. Sixth position contains a fluorine. Seventh position basically contains an piperazine ring which is necessary for its anti-pseudomonal activity. So it, along with their antibacterial, it shows anti-pseudomonal activity also. So this particular substitute at the seventh ring with an position with an piperazine ring is necessary for the anti-pseudomonal activity. Now let's go step by step to the SAR of quinolones. Why it is called quinolones? Because if you see, it is an pyridine ring which is fused to your benzene. So benzo-fused pyridine is known as quinoline, and it is called quinolones because it contains an carbonyl group at the fourth position. It contains a carbonyl group at the fourth position. That's why it is called quinolones. Okay. It is an pyridine fused to a benzene ring with the carbonyl group at the fourth position. That's why it is called quinolones, with the carboxylic acid group at the third carbon. So the general pharmacology required is 4-pyridine 3-carboxylic acid group with a ring attachment at the fifth and sixth position. So what does it contain? It contains basically it contains a pyridine ring with a carboxylic acid at the third position and a carbonyl group at the fourth position, and at the fifth and the sixth position it is fused to annulated to an benzene, to an aromatic ring. Presence of fluorine at the C6 position is necessary for its DNA topoisomerase enzyme for binding with the DNA topoisomerase enzymes of your bacteria. This is an overall pharmacophore. Now let's go into further details of the SAR. As I mentioned, the pyridone which is annulated to an aromatic ring is the major criteria requirement for your quinolones. So if you replace a carbon with the nitrogen, so it is an isoester. Isoester means you can replace it. The activity will be similar because of the similar electron density. So if your carbon is replaced by your nitrogen at some position, then you can retain the activity. Now depending upon the substitution. So if you substitute your nitrogen at the second position, it is called as sinolines. So if you substitute an carbon with the nitrogen at a second position, it is known as sinolines. An example is siloxane. If you substitute a carbon at the fifth position by a nitrogen, it is known as 1,5-naphthalidine. It is known as what? 1,5-naphthalidine. If you substitute a carbon at the sixth position with the nitrogen, then it is called as 1,6-naphthalidine. And if you substitute an carbon with the nitrogen at the eighth position, then it is known as 1,8-naphthalidine. So according to the position, you can write it is naphthalidine because it contains an extra nitrogen in the aromatic system. That's why it is called naphthalene, because naphthalene means is naphthalene, two fused ring with a nitrogen. Next is substitution at the second position reduces that. So if you see the structure over here, the substitution at the second position will reduce the activity. So there should be no substitution at the second position. Substitution at 5, 6, 7 and 8 of the annihilated ring produces good activity as mentioned. So if there is a substitution at 5, 6, 7 and 8, then the activity improves. Okay. Substitution at second, sixth position with the fluorine has significant increase in your antibacterial activity. Moreover, alkyl substitution at one position. So if there is an alkyl substitution at nitrogen 1, okay, in the A ring, if there is an alkyl substitution at the first position, then the activity is increased, and they also should be substituted by a lower alkyl group like ethyl methyl or cyclopropane. Then only the activity is written. If the ring increases, if the size of the alkyl group increases, activity decreases. Now let's see the effect on each position. Effect of substitution on the each position we have to see. Now let us say for the first position. So what does in the first position contains a nitrogen in the ring. So first position contains what? A nitrogen in the ring. So it should be substituted by a short alkyl substitution like ethyl or methyl. Later cyclopropyl ethyl fluorooctane ring were improved the activity against gram positive, but basically it is small alkyl group. Okay, so substitute ethyl fluorooctane. Octane is nothing but a 4-membered ring, cyclic ring containing oxygen. Then other thing is connecting the nitrogen 1 to the C8 displays increased in activity as well as viability. The example is ofloxacin. I think you might have used a lot in case of stomach infection. Ofloxacin, because when you connect your C1 with C1 with N1 with C8, you get your cyclic compound, fused compound, that is known as ofloxacin. Now let us go for the second and third position. So the third position should contain a carboxylic acid group, which is necessary for your activity. If you try to change it, carboxylic acid group with any other group, the activity is lost. This is necessary for your binding of your compound to your DNA gyrase of your bacterial cell. Any changes will reduce the activity. Replacement of carboxylic acid with an isothiazole ring. So if you replace your carboxylic acid with an isothiazole ring, it produces more potent drug but with poor solubility. So your carboxylic acid is necessary for increasing the solubility as well as its activity. So if you try to modify it with any other group, the activity is lost or the solubility is lost. So the third position should contain the carboxylic acid group, and there should be a double bond between the second and the third position for the activity. Now let's go for the fifth position. Let's go for the fifth position. So there should not be any bulky substitution. The substitution at the fifth position should be very small. Either methyl amino substitute increases the activity. Like example, gripafloxacin and SPARFLOXACIN. Example, gripafloxacin and SPARFLOXACIN. If you see in SPARFLOXACIN there is an amino substitution, and as in gripafloxacin there is a methyl substitution. So this is the substitution at the fifth position. So fifth position should contain an alkyl or an smaller amino group at the fifth position. Okay. So it should contain an alkyl or an amino group at the sixth position. No bulky substitution. Any bulky substitution reduces the activity. Now let's go for the seventh position. Sixth position, you know, it should contain a fluoro group. That is very much necessary for your DNA gyrase activity. Next, go for the seventh position. It should contain a heterocyclic ring like piperazine, 3,4-dimethyl piperazine or aminopyrrolidine with nitrogen. So any heterocyclic with the nitrogen will improve the activity against gram-negative bacteria and also increases the pharmacokinetic. What is pharmacokinetic? ADME property will be improved. If you got an heterocyclic, saturated heterocyclic compound containing nitrogen will increase the activity. Some of them might contain a bicyclic substituent. Example, NORFLOXACIN, bicyclic fused ring. If it is containing, then you get an increased activity. They will retain the active. Example, moxifloxacin, it contains an pyridine which is fused to your pyrrolidine. So pyridine fused to piperidine which is fused to your pyrrolidine bicyclic compound. It is known as moxifloxacin, NORFLOXACIN. Okay, so these are some of the examples of bicyclic or substitution at the 7th position. It should contain an heterocyclic ring like piperazine or a saturated. It should be a saturated. This will increase the viability or the ADME property. Lastly, at the 8th position, it might either contain a fluorine, chlorine, methoxy group. Okay, example, gatifloxacin and moxifloxacin. And replacement of carbon with nitrogen at the 6th position, at the 8th position also retains the activity. That is ecoxycin. That is an example of that. So this is an example of that compound. We'll be doing it later. So what is this now? The chemical structure. This was the SR. So what are the things which are present in your fluoroquinolines? What are the things which are present in your fluoroquinolines? So it contains an carboxylic acid at the 3rd position and a basic piperazine group at the 7th position. So it acts as a zwitterine. What do you mean by zwitterine? Because it has got an acidic portion as well as basic portion in the compound itself. That's why they act as an zwitterine. Means they have both acidic as well as basic characters in the structure. That's why they act as an zwitterine at physiological pH. So the H from your carboxylic acid will form a salt with the piperazine. So it will be always present in a zwitterion form. Like tetracyclines, they also have property to form, they have a beta diketo structure. So if you see over here, beta, so this is alpha position which is carbonyl group and a beta carbon. So when there are two diketo compounds, these are able to form a complex with your metals. So they can form a complex with your metal. That's the reason why this will lead to chelation, that is precipitation, and that leads to stone formation. So that's why whenever you are taking the fluoroquinoline, you should avoid taking mineral supplements and antacid like aluminum antacids and all should be not given. Whenever you are trying to give your fluoroquinolines, you should not consume any antacids. Formation of chelation leads to reduced oral availability and leads to your stone formation. Okay, so you should never consume an antacid containing calcium or all aluminum. Such type of antacid should not be taken. This is the reason why. This is the reason why. This is the reason why we should not take. So what it forms? It forms a metal coordinate complex between, and this will reduce the concentration. This leads to formation of crystal urea and leads to renal failure. This leads to renal failure. Very important from your examination point of view. Frequently asked question. Why should we not prescribe an antacid along with the fluoroquinoline? Why should we not prescribe an antacid or with an fluoroquinoline? Because it forms a metal complex which leads to chelation, which leads to an formation of crystal urea. This leads to renal failure by forming your stones. Okay, so this is the reason why you should not prescribe an antacid with your sulfonamide quinolones. So next example is NALIDIXIC acid. So if you see, NALIDIXIC acid is an example of 1,8-naphthalidine. It's an example of 1,8-naphthalidine. It's an example of 1,8-naphthalidine derivative. Okay, it contains an ethyl substitution at the first position. The 7th position contains an methyl group. It's not an example of fluoroquinone. It is a simple quinolone derivative. It's a simple quinolone derivative which contains an carboxylic at the 3rd and the carbonyl group at the 4th position and a methyl at the 7th position, and the carbon at the 8th position is replaced by a nitrogen. It is bactericidal agent and it acts by inhibiting the DNA gyrase enzyme. So which is the position? the beta dicarbonyl group is necessary for the activity. So that is NALIDIXIC acid. Next example is Sinoxaline. So Sinoxaline contains what? It is an example of 1,2 naphthalidine example, where your carbon at the second position is replaced by an nitrogen, and at the sixth and the seventh position it contains an 5-member dioxylane ring. It contains a 5-member dioxylane ring, that is a cyclic 5-member structure containing nitrogen, so containing oxygen into it. Okay, so remember the structure. Only structural difference is it contains an extra nitrogen at the second position, and it contains an oxylane ring at the dioxylane ring at the sixth and the seventh position. Okay, that is the structure of Sinoxaline. Next example is NORFLOXACIN. Next example is NORFLOXACIN. So NORFLOXACIN is an example of second generation. See the same thing with the similarity. It contains an piperazine ring at the 7th position, nitrogen at the 5th position, nitrogen at the 6th position, fluorine at the 6th position. So this is the structure, and there is no nitrogen at the 8th position. So that is the difference between NORFLOXACIN and your NALIDIXIC acid. Okay, that is NORFLOXACIN. Now let's go for the next example is inoxaline. So what is the difference between inoxaline and NORFLOXACIN? The only difference between inoxaline and NORFLOXACIN is that there is an extra nitrogen. There is an extra nitrogen at the 8th position. It's an example of 1,8-naphthalidine. So example of 1,8-naphthalidine is inoxaline. So it contains an nitrogen at the 7th position. It contains a nitrogen at the 8th position. That's the difference between inoxaline and NORFLOXACIN. Okay. Now next example is ciprofloxacin. So what do you see in the difference between ciprofloxacin and NORFLOXACIN? Everything is same. Only thing that nitrogen at the first position contains and cyclopropyl ring. So the nitrogen at the first position contains a cyclopropyl ring. It contains a cyclopropyl ring. Okay, that's the difference between your inoxaline and ciprofloxacin. That is, nitrogen is missing at the 8th position, and your ethyl substitution is replaced by a cyclopropyl group. That's the difference between inoxaline, ciprofloxacin, and NORFLOXACIN. Synthesis I'll be dealing with later. Ofloxacin. Ofloxacin is nothing. See, it is a cyclic, where your nitrogen at the first position is fused with the oxygen at the 8th position. It forms an morpholine ring. It forms a fused morpholine ring. Morpholine means it contains the nitrogen and oxygen at the 1 and 4 position, with a methyl substitution at the second, which is next to your nitrogen. So that is the structure of ofloxacin. It contains an 1,4-oxazine ring. It contains an 1,4-oxazine ring, which is attached between your nitrogen 1 and your carbon 4. Okay, it has got a better CNS presentation. It was found that the S isomer is more potent than the R isomer. This is nothing but your stereochemistry. Just remember that R isomer is more active than S isomer is more active than your R isomer. That's why levofloxacin nowadays, if you see, it is given as marketed as levofloxacin. SPARFLOXACIN, it contains a nitrogen and a fluoro and then dimethyl at the 3rd and the 5th position of your piperazine. So that is the structure of your SPARFLOXACIN. But there are many side effects because they cause phototoxicity and hepatotoxicity. So some of the side effects of this quinolines are nausea, vomiting, abdominal pain, headache, vertigo, visual disturbance, hallucination, urticaria, and your photosensitivity and hepatotoxicity. These are some of the side effects of your fluoroquinolones. So the next example is NITROFURANS. So what does this nitrofurantine contains? It contains an furan, nitrofuran. So if you see on the left hand side, if you see on the left hand side, it contains a nitrofuran group, which is attached to an amino hydantoin. Amino hydantoin is nothing but an amine nitrogen, which is alternative to an carbonyl group. So there are a nitrogen and a carbonyl which is attached to your amino group. So this is the structure of your nitrofurantine. So it contains a nitrofuran which is connected by a double bond to your amino hydantoin. Connected by a double bond to your amino hydantoin. Hydantoin is a 5-membered ring containing an alternate nitrogen and a carbonyl group, amide group, by amine group, 5-membered ring. So they are connected together to form an hydantoin. So mechanism of action. So this they work by damaging bacteria. They're active when they are so they act as a prodrug. So they get converted into your amino group. The nitro group gets converted into your amino group and they get incorporated into your flavor proteins and thus results in destroying your ribosomes, DNA and other macro molecules present in your microorganisms. So they are mostly used for urinary tract tract, but it is not effective against kidney infection. Basically, in a lower urinary tract infection, your nitrofurantines are good. It has got better viability. It is metabolized in the liver and half-life is around 20 and excreted in both urine as well as. Side effects are nausea, headache, flatulence, diarrhea, abdominal cramps, dizziness, and pulmonary toxic, hepatotoxic, and numbness. So these are some of the side effects of nitrofurantines. So they are synthesized how? By treating 5-nitro 2-furfural. So and furane containing an carbonyl group, that is an aldehyde group at the second position, is known as furfuraldehyde. Okay, which is connected to an 1-amino hydantoin. So it undergoes condensation reaction to give your nitrofurantine. And the last drug is methamine. So this is a complex drug. This is nothing but a combination of amino and your amine, that is a nitrogen and your furfural. When they are complexed, when they come together, they form a methamine. It forms a methamine. So it is nothing but a combination of your nitrogen, that is amino group, and your aldehyde. They come together to form your methamine. So when they get into the body, they get activated by biochemical transformation into your formaldehyde and ammonium iodine. So once they enter the body, they get converted into your formaldehyde and ammonium ion. So this is how they act. So this decomposes an acidic pH of your urine to release formaldehyde, and this formaldehyde has very antibacterial property. This is, as you have studied earlier also, they have got antibacterial property and they inhibit the bacterial growth. So they have got no antibacterial activity in blood as well as tissue, only their concentration is more in your urine. They are almost administered in combination with your mandelic acid. Some of the side effects are nausea, vomiting, epigastric distress, crystalluria. These are some of the treatment. They should not be given when there is a renal insufficiency. So in that cases, you should not give this methamine. It is not good. Clinical uses: norfloxacin, the dosage is 400 mg BID, ciprofloxacin 250 to 500 mg BID, ofloxacin can be given around 200 to 400 mg BID, leofloxacin 250 mg OD, that is once daily, lomifloxacin 400 mg OD, gatifloxacin 400 mg in a single dose. In case of bacterial diarrhea, norfloxacin can be given as 400 mg BID, ciprofloxacin 500 mg BID, and in case of gonococcal infection, norfloxacin 80 mg in single dose, ofloxacin 30 mg BID, ciprofloxacin 500 mg single dose, and lomifloxacin 400 mg single dose, and gatifloxacin at single dose of 500 mg. Moreover, this moxifloxacin and all, ciprofloxacin, they can also use for the treatment of eye and ear infection. They are available also as drops. So they, in case of